The NHS is failing. We need a new tax to save it. Benjamin Franklin once observed that the only certainties in life are death and taxation. None of us want to die and none of us want to pay taxation. But our politicians need to make a choice. Hospitals finished the last financial year £2.45 billion in the red. That's the biggest overspend in the history of the NHS. Simple fact is that NHS spending is not keeping up with medical technological progress and the ageing of the population. This country spends less on healthcare per capita than any other European country of similar income. But the government says everything's okay, and it's just that the GPs aren't working hard enough. So how can we find more money for healthcare without putting up general taxation? Privatisation is a sham solution. The private sector is entirely parasitic on the National Health Service. For instance, all the training is done in the state sector at taxpayers' expense. It's also well known that profit-seeking in medicine inevitably leads to unnecessary treatments and unnecessary investigation. What about a stripped-down NHS, which only treats serious conditions like trauma or cancer? Then what about conditions that might lead to cancer? What about high blood pressure? What about diabetes? Do we abandon the elderly? The answer surely must be a dedicated healthcare tax, what's called in the trade an hypothecated tax. Now, the Treasury has strong arguments against this. They don't like the public picking and choosing what they pay taxation for, but surely an exception should be made for the NHS we all love. If we knew what we were paying for, this would empower us as patients, and this would be an enormous force for improvement in the NHS. The government has made honesty a statutory duty for doctors such as myself, but its own dishonesty over the financial crisis facing the National Health Service is instead condemning it to death by 1,000 cuts.